Welcome to Zvia Weight Loss MedSpa. If you've ever dealt with an injury that just refuses to fully heal, like a knee that still aches months later, or a gut that seems to react to everything, or maybe recovery that used to take days now stretches into weeks, you are definitely not imagining it.
It's one of the most frustrating feelings, right? You're doing all the right things, you're being patient, but it just feels like your body's own repair systems have slowed way down and you're just not bouncing back the way you used to.
And that's exactly why it can feel so discouraging. It's not because you're lazy or skipping steps, it's that your biology isn't quite keeping up. But what if you could give those repair systems a really targeted boost? Well, that's exactly why we need to talk about BPC-157.
Okay, so what is this stuff? BPC-157 is a small peptide, just 15 amino acids long, and it's actually derived from a protective protein that's found right in our own stomach acid. And the reason we're so excited about it is that it tackles that problem of stalled healing we were just talking about, but it does it from a bunch of different angles all at the same time.
So let's talk about why healing stalls in the first place, that healing plateau. A lot of the time, it's because these really important receptors called VEGR2, which are basically the on switches for growing new blood vessels, they just aren't getting activated. And you can imagine, without new blood vessels, that damaged tissue is literally starving for the oxygen and nutrients it needs to rebuild. This is that critical point where healing can slow to a crawl or sometimes stop altogether.
Right. And we see this in preclinical models, where injuries take so much longer to heal without this kind of support. BPC-157 is designed to fill that exact gap. But here's the key, and this is really important. It's not about overriding your biology. It's about switching on the powerful healing systems that you already have.
So how does it pull this off? It uses something called convergent pathway activation. I know, that sounds technical, but all it really means is that it works through several different systems at once to create this one big, powerful healing response. Let's break down the three main pathways it uses.
Okay, pathway number one. It starts by binding to those VEGR2 receptors we talked about. This kicks off a chain reaction that produces nitric oxide. Now, you can think of nitric oxide as the open for business sign for your blood vessels. It tells them to relax and widen, which brings a flood of fresh blood, oxygen, and all those good growth factors right to the site of the injury.
And what's just brilliant about this is the built-in redundancy. Your body is so smart. BPC-157 can actually trigger nitric oxide production through two totally separate pathways. So if one of those routes is maybe a little sluggish because of age or inflammation, the other one can step in and pick up the slack. It's like having a backup generator for healing. It's just an elegant system.
All right, on to pathway number 2. This is about the actual construction work. This pathway involves proteins that control how your cells grip onto each other and move around. BPC-157 ramps up these proteins in your fibroblasts, which are your main tissue-building cells. This makes sure that the new tissue being built is strong, organized, and can actually handle a load, not just a patch of weak, disorganized scar tissue. And finally, pathway number 3 is all about creating the right work environment. It's an immune regulation pathway. This cascade basically tells your genes to turn down the inflammation. So while all that amazing rebuilding is happening from the first two pathways, this one is busy quieting everything down. It creates this perfect, calm environment for high-quality repair to happen.
Now, this might be the most remarkable part of the whole story. Even though BPC-177 has a super short half-life, we're talking under 30 minutes, its effects in animal studies have been shown to last for up to 360 days. How is that possible? Well, because once these healing pathways are turned on, they become self-sustaining. The peptide is just the spark. Your body's own systems carry the flame from there.
Okay, so let's get practical. What does this timeline actually look like for someone? Well, it can get going pretty quickly, especially with delivery methods like subcutaneous injection or buccal delivery, because they get to work fast by bypassing the digestive system.
In those first couple of weeks, what we call the opening, that initial blood vessel growth and the anti-inflammatory effects really start to kick in. This is when people often first notice, a drop in pain, less stiffness, and just a general improvement in their range of motion. Then, from about week 3 to 6, you hit the building momentum phase. This is where the serious structural work happens. Collagen fibers are strengthening and cross-linking. Your functional capacity goes up. You find you can do more with less pain. And if it's a gut protocol, those digestive improvements become much more consistent. And finally, week 6 to 12, we call this the crescendo. This is when that new tissue really matures and remodels, leading to almost complete restoration. For a musculoskeletal injury, that means getting back to your full activity. For gut issues, it often means being able to tolerate all kinds of foods again. Now, it's really important to say that how you use BPC-157 matters a lot. Here at Zvia, this is absolutely not a one-size-fits-all thing. Your provider is going to carefully select the right delivery method based on your specific goals and your unique clinical picture.
For example, a subcutaneous injection gets a high concentration of the peptide right where you need it. It creates what's called a depot effect, so it releases slowly over time, which is fantastic for things like tendon or ligament injuries.
But then you have buccal delivery, which is totally non-invasive. You just place it between your cheek and gum. It gets absorbed very quickly and is often our go-to for supporting GI healing from a more systemic level.
And really, this is what we call the Zvia edge. We only use pharmaceutical-grade compounds from sources we trust implicitly. We combine that with comprehensive lab work and, most importantly, continuous monitoring from your provider. Honestly, DIY approaches or those high-volume telehealth models, they just can't come close to this level of safety and precision.
At the end of the day, it's about getting precision care from a team of people who are genuinely, personally invested in seeing you get better. We're right there with you for the whole journey.
So if there's one thing to take away from all this, it's that BPC-157 isn't some magic shortcut. It's about giving your body the specific support it needs, with an expert team guiding you, to unlock your own repair systems and let them work at their absolute full potential.
If you'd like to learn more and find out if this could be the right approach for you, please visit our website at zvia.com. That's zvia.com, or you can always give us a call at 303-902-5353 to schedule your consultation.
And of course, please remember that this is for educational purposes. It's essential that a qualified provider evaluates your individual situation to determine if any treatment is appropriate for you.